I'm Dr Anthony Maloof of Corneal and Oculoplastic Surgery in Eyes and Faces in Sydney, and welcome to this video on improving vision with Intacs. Intacs is a trade name for a product where rigid rods are inserted into the front of the cornea to try and improve vision in keratoconus. They were originally developed for short-sightedness, a treatment for short-sightedness, and they treated about anywhere from -1 to -3 diopters. Not a very big range. However, they've found a home in keratoconus and they're sold to patients as a non-surgical option, minimally invasive surgical option to improve your vision. And here's how they're supposed to work. You put a rigid ring in and it's supposed to stretch the cornea, change the shape and make your vision more regular. But think of it this way. Imagine if you had a trampoline and in the middle of the trampoline you put a hunk of steel. You wouldn't expect that to make the trampoline more taut. In fact, what it does is it actually stretches the trampoline. And the same thing in the cornea. You put this round bit of tissue in, hard plastic into the tissue, and it stretches around it. I find that my patients that have had Intacs usually come to me and ask me to remove them. So how do I improve vision with Intacs? I remove them, and I do it by converting it to a stromal transplant. Here you're going to see a young lady who had Intacs, paid a lot of money for these Intacs, and was told by her doctor every 6 months, no, it'll get better, it'll get better, it'll get better. 5 years later, she'd had enough. She came to see me, and you see the Intacs here at surgery. I proceeded to do a stromal transplant, did the surgery, took the front layer off, sent it to pathology, placed a new tissue on, and in 2 weeks she came back and said, finally, I can see. Now her vision will continue to improve. She went from very, very poor vision at 6:36, she's already at driving vision at 2 weeks. Great result. Unfortunately, Intacs don't always deliver what they promise. They work well in very mild disease, but if you've got anything more, they're probably not going to give you what you want. It's for that reason I call Intacs prosthetic Lego. You can build lots of stuff with it, but you don't get to do much more than that. Thanks for watching. I hope that's been helpful to you. I'm Dr Anthony Maloof of Corneal and Oculoplastic Surgery in Eyes and Faces in Sydney.